Let's start with a quick 30-second biographical self-introduction of each debater.
Hi, my name is Mike Plunkett. I am the Dental Director for Care Oregon, which is one of the state's largest health organizations which cares for Oregon Health Plan patients. I'm also the Dental Director of Neighborhood Health Center, where I see patients. My patient care is limited to Oregon Health Plan and low-income populations. And I am a professor of community dentistry at Oregon Health Science University.
Good evening. My name is Alejandro Peral. I am a program officer with the Northwest Health Foundation. I am also the co-chair of the Healthy Kids, Healthy Portland campaign. My background is I have a degree in law and a master's degree in biology. I have worked for Multnomah County Health Department, American Heart Association, and the Sierra Community.
My name is Kelly Barnes. Thank you for coming out tonight. I'm a physical therapist of 20 years. I have 7 graduate years of studying physical therapy. More importantly, I'm a mom of 2 children. And I first became interested in this issue when my dentist about a decade ago asked me to look at the literature because there was statewide legislation pending. He opposed that legislation, and I started reading the literature and discovered that this was not a safe policy for our community. And here I am.
I'm Rick North. I spent about over 30 years in health organizations, nonprofit, a little bit in the environment. 21 years with the American Cancer Society. I was the former state director of the American Cancer Society. Before I retired 2 years ago, I worked over 7 years with Oregon Physicians for Social Responsibility. And I always say, I'm not a physician, I'm more a scientist. I just happen to have worked with them for many, many years.
Thank you. Okay, for opening remarks, the pro side, please start.
Yes, first of all, I want to thank Multnomah County Democrats for hosting this event, and thank members of the audience for coming out, and thank our opponents for coming as well. I can speak for Alejandro and the Healthy Kids, Healthy Portland Coalition in saying that we're very excited to be involved in this process, a process which could lead to a community health measure that could benefit so many members of our community. As a public health dentist, a community health dentist, I see firsthand daily the effects of untreated dental disease, not only on children, but on all members of our family, all members of our community. I think, start off with a story I think that is a good representation of what many of us that do this daily as our careers see. A couple of years ago, I was on a medical team's van, and I saw a young girl, 11 years old, 12 years old. She came in with an abscess, was brought in by the school nurse. As I was working up to remove her tooth, I explained to her that she would be sore, there would be pain, and for a couple days afterward, and that she'd have trouble eating. She said to me, she started crying, and she said to me, "Doctor, I haven't eaten on that side of my mouth for 2 months, and I haven't been sleeping very well. Please help." But that's not an isolated story. I could do that for an hour. Anyone, any school nurse that sees patients that I see could do that for an hour. In fact, over 1/3 of Oregon's children have untreated dental decay. And dental pain is one of the top reasons people go to hospital emergency departments. I know this because I work with many hospitals in the region to treat their patients. I have programs daily. We do this. Many of us do this. And as a dentist and as a professor of community dentistry, I can tell you confidently that much of this is preventable, and it would be prevented if we fluoridated our water. Other communities have experienced that. But this debate is really not just about fluoride. It's about something much larger. It cuts to a larger question as to whether or not we in Portland are willing to implement solutions to problems that benefit all members of our community and think past our biases, think past our concerns, look at the evidence, face up, and implement solutions that benefit the entire community. Do we respect science? Do we as Portlanders respect the scientific process? Are we willing to look beyond the scope of our own opinions and see what the experience of other communities has been? Now, throughout the rest of the night and throughout this campaign, there's going to be a lot of scary things said. I suspect in the next hour we're going to hear about every single system of the body. Terrifying things. And that's the intent, the sole intent. When we talk about the multiple areas of the body, the systems of the body, is to scare. A tactic, it's a political tactic. The truth is, hundreds of articles, if not thousands of articles conducted by respected institutions and dedicated scientists over decades have concluded that community water fluoridation is the most safe and effective way to reduce dental disease and the burden of dental disease. It's the most cost-effective way, and it's the best way to alleviate the burden of dental disease for all members of any community that's brave enough to implement community water fluoridation. The science shows this. Every Surgeon General in the last 60 years has endorsed community water fluoridation. The Center for Disease Control, Institute of Medicine, National Academy of Science, I could go on, all endorse it. Every single organization that supports children's health care, most respected organizations, if not all, that I'm aware of, that deal with public health, health care, and advocacy in this area, endorse community water fluoridation. The current Surgeon General, we'll talk about that more, Regina Benjamin, has endorsed it, does endorse it, and her office currently endorses it. And all of these organizations endorse it unequivocally as the cornerstone of any comprehensive program to reduce the burden of dental disease in the community. Healthy Kids, Healthy Portland, which we represent, has been endorsed by over 80 local organizations ranging philanthropy, human services, healthcare, and I'm proud of that. And as we move on tonight, you'll hear their names and you'll recognize them. They're full of physicians and advocates that love their community, engage their community every day toward reducing the burden of disease and enhanced human wellness. It's time we act, and it's time we act consistent with the Portland value that so many of us hold dear. The value that it's not just about me, it's not just about what I want, but that we should implement solutions that benefit all members of our community. Healthy Kids, Healthy Portland Coalition welcomes you to join us in that fight.
I'm a volunteer for Clean Water Portland. We're the group that gathered over 43,000 signatures in less than a month to bring this to public vote because we believe you should have that choice to vote. I believe in keeping fluoridation chemicals free from our water for 3 reasons. I believe clean water is essential for the health of our community and the health of our kids, and that the recent scientific evidence demonstrates a reasonable basis for concern of this policy. In addition, there are surely better alternatives that are already present, funded by our government and our local communities. Cavities do cause real pain and real suffering. We can and we should do more to prevent them. However, using dramatic anecdotal stories are useful in political campaigns, and they tug at our heart, but they should not be mixed up with the real science or the real numbers. When it comes to Portland's numbers, we are not in a unique dental healthcare crisis, as though you hear or read in the paper. In fact, Portland Metro has an untreated dental decay of 21%. Outside of Portland Metro, 44%. The national oral health objective of our nation is 26%. We've already exceeded that, mostly on non-fluoridated water. When you put this into a national context, we are doing well here, and we should surely be talking about Portland's numbers when we're talking about fluoridating Portland's water. Recently, many organizations have joined our campaign endorsing the Sierra Club, Food and Water Watch, local acupuncturists, and Oregon Chiropractic Associations, including over 60 physicians, medical, osteopathic, and naturopathic. And while these endorsements are important, we believe that you should research this topic. It's vast and it's complex. And once you do, you will see that there's a reasonable basis for concern of this policy. And while those in support of fluoridation, can you guys hear me? Yeah. While there are many organizations that they talk about endorsing, it should be mentioned that we're not aware of any of these organizations reaching across asking for an oppositional perspective prior to endorsing. Surely there's value to hearing both sides of this story. So what are we talking about? Portland Water Bureau has been clear. We are talking about adding fluorosilicic acid to our water. I was surprised to learn about this as well, but if you look at your handouts and go to the National Academy of Sciences slide, you will see that this is a byproduct of the phosphate fertilizer industry. The CDC agrees. These chemicals are not calcium fluoride, they're not even pharmaceutical grade fluoride. These are the byproducts of the phosphate fertilizer industry, and they are captured by air pollution, brushes called wet scrubbers. They are then given to your city for fluoridation. They are so acidic at a pH of 1.2, the city will further have to add compounds simply to buffer them. And these are particularly important because when they are added to other disinfectants such as chloramines, which are present in our water, they have also been found to leach lead. Surely, if the health of our kids is what we are talking about, we don't need more contaminants and more lead in our water. If you look at page 6 on your slide, the NSF fact sheet, left-hand column, posted on the CDC website, you will see that 43% of these samples show arsenic, 2% lead, 3% copper, mercury, chromium, and other heavy metals as well. They will say, hey, they're low enough, they're not too high. I've heard there's more in green tea. However, the EPA's been very clear. There are no safe levels for lead and arsenic in our drinking water. And I don't think it knowingly makes any sense to add more heavy metals if the health of our children is what we're talking about. They like to say the National Academy of Sciences study has no bearing on water fluoridation. However, the direct result of that study had two major occurrences. One, our federal government reduced the maximum level of concentration of fluoride in our drinking water by 40%, the first time in 50 years. The ADA and CDC and others issued an infant advisory statement, meaning that if your infant is using formula with fluoridated water, they're at risk for fluorosis. Just turned it off, I think.
You stop the clock.
Stop the clock.
Testing. Hello, hello.
Good. I still want feedback when we're getting. Okay, good.
I think part of the problem is you're holding the mic too close and they're
Okay. Now just let me know if you can't hear me. However, I saw that clock running, so I could use another couple of seconds there. So anyway, if you look in your handout, you will see that the authors and scientists and doctors on the panel, some of them oppose water fluoridation from the National Academy of Science study, and you can read their quote yourself. The other side likes to say this is junk science, don't pay any attention to it, but that study found real risk to the immune system, risk of cancer, the endocrine system, as well as risk to the brain. And they like to discredit this science, but this is science-funded research published in some of our top scientific research journals and institutions of our country. And while many in the medical establishment like to say this is safe, beyond question, safe and effective, I've heard them say, there's never been a randomized controlled trial of safety and effectiveness, ever. And one does not have to think back very far to think of a long list of chemicals, drugs, and products that our government said was safe, and we now know is not. The CDC says the benefit's topical, not swallowed. National Academy of Sciences agree. And there are now better alternatives that we have right here in Oregon that I hope we address in more detail tonight that can clearly show that this risk is not worth the benefit. Thank you.
Okay, thank you for your opening remarks. The first question will be given to the con side because the pro side opened the debate. What are the benefits and/or harms of fluoridating the water supply, and what studies support your position?
Let me just give you a few bullet points here on effectiveness. Look at cities. I want to read you a quote, a 2011 quote from the San Antonio newspaper. Quote, after 9 years and $3 million of adding fluoride, research shows tooth decay hasn't dropped among the poorest of Bexar County's children. It has only increased, up 13% this year. Then there were a series of studies done in the early 2000s from cities all over the world that had fluoridated and stopped. Cities in Canada, Germany, Finland, Cuba, Durham, North Carolina did not see an increase in cavities when they stopped fluoridation. In fact, several of them saw rates go down. As Kelly said, there has never been a randomized controlled trial for safety or effectiveness, the gold standard in scientific experiments. York University, which did a review of hundreds of these effectiveness studies, did not rate 1 at the highest level of quality. The largest U.S. survey, National Institute of Dental Research, less than 1 cavity, about a half a cavity difference per kid from fluoridated and non-fluoridated. not even statistically significant. The most prestigious study in the United States, the ongoing Iowa study, which measures total fluoride experience, said the effects were mostly topical. And even the CDC said that. As far as harm, I refer you to this sheet. Please get one if you haven't already, listing right down what the National Academy of Sciences 2006 report said, the most authoritative report there is. Bone cancer, bone fractures, diabetes, endocrine system disruption, kidney disease, thyroid disease. That report said that every one of these, fluoride was either a definite risk or a potential risk to human health.
Thank you. 2 minutes?
Yeah, I'd like to start my reply with a quote. I do not believe that there is any valid scientific reason for fearing adverse health conditions from the consumption of water fluoridated at the optimal level. John Dull, MD, PhD, Chair of the National Academy of Sciences, National Research Council 2006 report on fluoride in drinking water. I can read that again if you like. This is the man who chaired the council that produced the report that you're going to hear about in every single one of their statements tonight. He does not see any reason to fear the health effects of optimally fluoridated water. When I teach my class about the effects of fluoride and the positive effects of fluoride, here's what I tell them. There's a strong topical effect. That is, the fluoride enters in the tooth, strengthens the enamel, and that is considered a mild microscopic fluorosis because it hardens the enamel and makes it impervious to decay. So you're going to hear the word fluorosis as if it's the boogeyman. It's as if it's some disease that's going to infect you. And severe fluorosis is horrible. And they'll never see a picture of mild fluorosis. You'll hear fluorosis, then you'll see a picture of severe fluorosis, which we almost never see outside of areas which are really in harmful concentrations. So the benefits of community water fluoride is topical, but it's the effect of it being in the saliva at a minimal amount and entering the surface of the tooth and making the tooth impervious to decay, which creates a front line against the decay that causes the tragic stories that I'm not using as hyperbole. And anyone that sat in front of the family of one of these young children or one of these young children and talked to them about it, drained the pus out of their cheek, took out their teeth, watched them cry, seen them traumatized, don't take that lightly. I'm not trying to dramatize it so you'll vote for fluoride. I'm telling you, it happens more when the water is not fluoridated. And if you're the one removing the tooth, it means something to you.
Okay, 1 minute rebuttal.
Okay, first, I'd like to address you to page 5 of your handout. You can see another quote from the chair, John Dole, in which he's concerned about the effects of this policy on the community, and I will let you read that yourself. In addition, Kathleen Thiessen, one of the people on the panel as well, direct quote, governments and health agencies that are serious about protecting the health of their population should call for an immediate end to community water fluoridation. Yes, there's discrepancy in the science. There's new emerging science that is coming out. People do not consistently believe that this is a good policy, including the chair of that committee. In addition, fluorosis, there are different forms, but fluorosis is the first visible sign of overexposure to fluoride. And 41% of our kids, according to the CDC, already have it. And incidentally, children of color are more at risk to fluorosis than children of non-color. Now we have to start asking ourselves why. And this is not only mild forms, this is moderate and severe forms of fluorosis. And you can see those statistics in your chart as well. So when we talk about fluorosis, I'm a physical therapist. I study bone health. That is an indication of something else happening to the bone tissue as well.
Thank you.
I do not believe that there is any valid scientific reason for fearing adverse health conditions from the consumption of water fluoridated at the optimal level. John Dole, this was in the last few months. So I'm not sure what they're talking about or what his past views on it, but this was written recently. And as far as effects on bone tissue, if I see valid science, if the Center for Disease Control, the Surgeon General of the United States, or any major body that I look to for guidance when I treat my patients, when I teach my students, when I advocate on behalf of the larger issue of healthcare access and healthcare best practice, I'm not going to listen to a single physical therapist, even though I respect her. I'm sure her clinical skill is superb. But I'm not going to call her and ask. I'm going to look to respected bodies like the Surgeon General, like the Center for Disease Control, and they unanimously support community water fluoridation as the most safe and effective way to reduce dental decay across the population.
Okay, next question for the pro side. What is the optimal dose for fluoride? What is the harmful dose? How do these compare with the proposed dose?
There is no optimal
This
dose.
is, excuse me, pro side. I disagree. Can we start the clock over, please?
The optimal level of fluoridation is 0.7 parts per million. Pardon me, can you hear me now? The optimal level for water fluoridation is 0.7 parts per million. We have had water fluoridation for 60 years in the United States. 3/4 of the population have experienced this. There have been no adverse health effects reported. There is no scientific credible evidence that would suggest that at 0.7 parts per million there are any adverse health effects. There is the Environmental Protection Agency has set the maximum daily load, the maximum amount of fluoride that one can drink in the water at 4 parts per million. But that is not optimal fluoridation. What we're talking about here are levels that have been set by the Centers for Disease Control, Health and Human Services, and every agency and every international health organization that is well respected has supported this. As Mike said, has been a unanimous support for optimal water fluoridation at 0.7 parts per million.
Reset the clock, please. Go ahead.
Let's face it, science changes before policy. We've seen that many times in the history of our country. There is no optimal dose for fluoride. The dose of a drug in water cannot be measured. What we do know is that 41% of our kids, according to the CDC, are getting too high of a dose of fluoride already because they have the outward visible sign of fluorosis. According to the FDA, fluoride's a drug. Fluoride, when used to diagnose, cure, mitigate, treatment, or prevention of disease in man or animal, it's a drug. Concentration of fluoride is not dose specific. It depends on your body weight, the health of your kidneys, how much water you drink, and other factors. And due to the fact that these fluoridation chemicals also have arsenic, lead, copper, and other heavy metals, there are no safe levels. The EPA has been clear, there are no safe levels of arsenic and lead in our drinking water. Arsenic and lead are bioaccumulative. Studies show risk of fluoride at concentrations proposed for drinking water. The National Academy of Science review of over hundreds of studies indicated low levels of fluoridation can have adverse risks. Populations such as infants, the elderly, those with kidney disease, thyroid disease, and diabetes are particularly vulnerable. That is a lot of us in Portland. The CDC, the ADA, and others have infant advisory statements that show risk to infants of fluorosis. You can see this on the CDC website. Fluorosis is the first visible sign of overexposure. When adding fluoride to our drinking water, the policy is essentially adding an unapproved drug, and one that has uncontrollable exposure to our population. At best, it's inappropriate for many, such as those who don't want it or can't drink it, those who have high water consumption, formula-fed infants, people with renal disease, or hypothyroidism. There's no optimal dose.
I think it's important to point out, first of all, that the National Academy of Sciences report actually expressly said this is not a review of community water fluoridation levels. It was a much larger review of a whole host of studies that looked at much higher concentrations of fluoride. Secondly, this assertion that adding fluoride compounds to the water, to the drinking water, will also add arsenic and lead, has not been found in any other community that has fluoridated water. How do you know? First of all, let me just be clear. Nothing in the universe is pure. Everything has a mixture of things. And the fact of the matter is that when you optimally fluoridate water in a community, you can measure the before and after levels of arsenic, lead, and other
Bring your
contaminants.
mic a little bit higher.
The fact of the matter is that we already have arsenic in the water. And when we've measured pre
and post addition of fluoride compounds to water. There's been no increases in arsenic, no increases in lead. I think this is really a tactic to scare you against water fluoridation.
I have to say something about this National Academy of Sciences study, because it was specifically talking about all kinds of human health effects, okay? And all you gotta do is look at this. We've got the specific page numbers. This is online, it is free, you can go right there, and if you think we're taking these quotes out of context, talking about human health effects from fluoride, we invite you to go right to that, and you can see for yourself, it is not taken out of context. And it is not talking specifically about 4 parts per million or more.
I just wanted to say, yes, we have levels of arsenic in our environment, in our food, and in our water. That's kind of the point. We don't want to knowingly add any more. And I'm not making this data up. Look at your handout, it's on the CDC website. These contaminants are present in the fluorosilicic acids that will be added to our water.
Okay, 2 minutes for the con side. How much fluoride do most people get from toothpaste or other sources? How much do children and infants get?
The National Academy of Science study reports that fluoridated water is our biggest source of fluoride. Whoops, sorry guys. Where are we? This is the reason with fluoridated water that we're already exposed so much. It's been cleared through that study. The biggest risk that they saw to our kids, again, was fluorosis, an overexposure to fluoride. We get a lot already in many diverse forms, drinking beverages from reconstituted water, to raisins that your kid eats, to the pesticide in your food. This overexposure is one of the reasons why so many of our kids already have fluorosis. They like to say it's no big deal, white blotches on your teeth, it's just cosmetic. Fluorine disrupts the bone matrix of the enamel on the teeth, just like it does to the bones in our body. I read this literature, I deal with bone literature every day in my practice. We know that fluoride works topically. We know they say do not swallow on our toothpaste. There are real risks to swallowing fluoride. We also know that topically, due to the research of toothpaste, it doesn't work at 0.7 parts per million. Yet the CDC says the benefit of water fluoridation is topical, not systemic. When you think about how much you'll be taking in, one 12-ounce glass of water is equal to a pea-sized toothpaste at 1,000 parts per million. The water they're proposing fluoridating at 0.7, one 12-ounce glass, one pea-sized toothpaste. Think about that throughout the day. 5 glasses of water, a strip of toothpaste. I don't know about you, but I don't want my kids swallowing a strip of toothpaste, especially when there are other contaminants of arsenic and lead and heavy metals.